Oil pulling has become increasingly popular in recent years as a natural oral care method, claiming benefits like fresher breath, whiter teeth, and improved gum health. But how effective is this practice? Let's explore the history, the science behind it, and whether oil pulling really benefits your teeth and gums. What is oil pulling? Oil pulling is an ancient Ayurvedic practice that involves swishing oil, typically coconut, sesame, or sunflower oil, in your mouth for about 15 to 20 minutes before spitting it out. Proponents of oil pulling believe that it helps pull toxins from the mouth, reduce bacteria, and promote overall oral health. The most common oils used in oil pulling are coconut oil, popular due to its pleasant taste and antibacterial properties; sesame oil, traditionally used in Ayurvedic medicine; sunflower oil, another mild option for oil pulling. The claimed benefits of oil pulling. Many proponents of oil pulling believe it has several oral health benefits. Reduces harmful bacteria. The mouth is home to hundreds of bacteria, some of which can cause plaque buildup and lead to cavities and gum disease. Oil pulling is said to reduce the number of harmful bacteria, which may lead to healthier teeth and gums. Improves gum health. Swishing oil is believed to help reduce inflammation in the gums, decreasing the risk of gingivitis and other gum issues. Prevents cavities. Some argue that oil pulling can help prevent cavities by reducing plaque and bacteria that cause tooth decay. Whitens teeth. Anecdotal evidence suggests that regular oil pulling may help remove stains from the teeth, leading to a whiter smile. Freshens breath. Because it removes some of the harmful bacteria in the mouth, oil pulling is said to help combat bad breath. Removes toxins. In Ayurveda, oil pulling is believed to detoxify the body by eliminating toxins from the mouth. What does the science say? While there are numerous claims about the benefits of oil pulling, scientific research on the practice is still limited. Here's what the science tells us about the effectiveness of oil pulling. Reduction in harmful bacteria. Some studies suggest that oil pulling may reduce harmful bacteria in the mouth, particularly Streptococcus mutans, which is a major contributor to tooth decay. For example, a study published in the Journal of Clinical and Diagnostic Research in 2016 found that oil pulling with coconut oil significantly reduced Streptococcus mutans in the saliva of participants, improved gum health. Research indicates that oil pulling may help reduce gingivitis, an early form of gum disease. A small study published in the Journal of Indian Society of Periodontology found that sesame oil pulling was effective in reducing plaque and gingivitis when used as a supplement to regular oral hygiene practices. Comparable to mouthwash. Some studies compare oil pulling to traditional mouthwashes. For example, research in the Journal of Contemporary Dental Practice in 2011 found that oil pulling with sesame oil had a similar effect on reducing plaque as chlorhexidine mouthwash, which is commonly prescribed by dentists. Teeth whitening. There is no strong scientific evidence to support the idea that oil pulling whitens teeth. Most of the support for this claim is anecdotal, and any whitening effect may be due to the removal of surface stains rather than actual bleaching. Bad breath. Oil pulling may help reduce bad breath, particularly if the cause is bacterial. A study in the Journal of Clinical and Diagnostic Research found that oil pulling was effective in reducing bad breath caused by bacteria in the mouth. Is oil pulling a substitute for brushing and flossing? While oil pulling may offer some benefits, it is not a replacement for traditional oral hygiene practices like brushing and flossing. Dentists recommend brushing your teeth twice a day with fluoride toothpaste and flossing daily to remove plaque from areas that your toothbrush can't reach. Oil pulling can be used as an adjunct to regular oral care, but it should not be relied upon as the sole method of maintaining oral health. Potential downsides of oil. Oil pulling is generally considered safe, but there are a few potential downsides to keep in mind. Time commitment. Swishing oil for 15 to 20 minutes can be time-consuming and may not be practical for everyone. No fluoride. Unlike toothpaste, oil does not contain fluoride, which is important for strengthening tooth enamel and preventing cavities. Possible discomfort. Some people find oil pulling unpleasant due to the texture and the extended swishing time, not a cure-all. Despite its many claims, Oil pulling cannot cure or prevent major oral health issues like cavities, gum disease, or tooth loss. It is important to visit your dentist regularly and maintain proper oral hygiene. How to try oil. Pulling safely. If you're curious about oil pulling and want to give it a try, follow these steps to ensure you're doing it safely. Choose the right oil. Coconut oil is a popular choice due to its antibacterial properties, mild flavor, and smooth texture. Sesame and sunflower oils are also effective alternatives. Use a small amount. Start with about 1 tablespoon of oil. You don't need more than that to get the benefits. Swish gently. Swish the oil around your mouth for 15 to 20 minutes, but don't swish too vigorously. The goal is to allow the oil to reach all parts of your mouth without causing discomfort. Spit it out. After swishing, spit the oil into a trash can, not the sink, as oil can clog drains. Do not swallow the oil, as it may contain bacteria and toxins from your mouth. Brush your teeth. After oil pulling, brush your teeth as you normally would to remove any remaining oil and bacteria. Conclusion: does oil pulling really benefit your teeth and gums? The evidence supporting oil pulling is still limited, and while it may offer some oral health benefits, it is not a miracle cure. If you enjoy oil pulling and feel that it freshens your breath or helps with minor oral issues, it can be a useful supplement to your daily routine. However, it's important to continue brushing, flossing, and visiting your dentist regularly for optimal oral health. In short, oil pulling can be a helpful addition to your oral care routine, but it shouldn't replace tried-and-true methods of keeping your teeth and gums healthy. Thanks for watching. If you enjoy content like this, please subscribe.